Hello and welcome to another episode of Conversations with Dr. Westman. Today we're going to be chatting about acid reflux or GERD. We also have a bonus for you, and that is Dr. Westman's free top 10 fat loss tips. We'll put a link in the description for you guys. How are you, Eric?
I'm good. How are you, Glenn?
Very, very good. Thank you. So I know that acid reflux, heartburn, or GERD is a very, very common condition that you see in your clinic. It affects around about 20% of the population in the United States. Can you explain what acid reflux or GERD is?
Sure. So it goes by many different names, heartburn. GERD, it stands for gastroesophageal reflux disease. Thus, saying reflux is kind of short for GERD. And heartburn, is a pretty good descriptor, meaning that there's a burning sensation in the middle of the chest, where a lot of people think the heart is. Well, it's in the middle left side. And so it's been called heartburn because it's an uncomfortable burning sensation. And if you've never felt it, it's pretty characteristic. I mean, it's uncomfortable. It might come up into the throat, and typically it'll happen after the spaghetti and meatballs and or pizza. You're over consuming the amount that you eat. And then it goes away really fast when you have an antacid like Rolaids or Tums or Mylanta or some kind of antacid. So that's where reflux and heartburn has been always associated with acid in the stomach, because when you take something that blocks acid, and now we have pills that block acid production, the symptoms go away for most people. So this is not to be confused with true heart pain or heart discomfort. And chest pain from the heart itself is usually not called a pain. It's usually called a uncomfortable feeling, someone sitting on your chest, or chest tightness. So we, in the medical world, think of chest tightness as something that we would then raise a red flag and evaluate differently. So heartburn itself is kind of a burning sensation, where tightness, I would be more concerned if you told me that. So don't confuse those things. We, as an internist who went through training, and as a chief resident, and then a fellow, and in an academic setting, we all know that there are people who misunderstand. They think it's heartburn, but it's really not. It's the heart itself giving the pain. So if what you're having is not going away with antacids or a keto diet or any of these other pills, that's a whole nother discussion that I would be more worried about. But just I wanted to get that out there, because the heartburn itself, it goes away. You've had it after a meal. You'll get to know what that is, and that's not life-threatening.
Now, to your knowledge, what causes acid reflux?
Well, the most common cause of acid reflux is acid. Too much stomach acid. You feel it at the top junction where the esophagus, the food pipe, comes into the stomach itself. And if the acid brushes up against the esophagus, that gives the symptom. If the stomach acid gets into the esophagus up a little bit, you feel that heart burning, the heartburn sensation itself. So there already I introduced the idea that there's an anatomic or a physical connection, that if this is abnormal, also known as a hiatal hernia, where the esophagus and the stomach come together and it's not normally kind of tight, this can be a reason for heartburn that is not just the acid. It's actually, there's a anatomic or a physical reason why you might feel it. The only way to know that is to have a doctor do a test where you swallow something and it lights up the heart, the stomach area, or you swallow a tube and they look in to see if there's that hiatal hernia or not. But most people, it's just excess stomach acid.
Now, if we go one step further back, what causes the excess stomach acid, because I know that a keto diet can fix it. So now we want to try and understand why is it that we're getting this excess acid in the first place.
Well, so this is the very interesting, yes, a keto diet can fix heartburn. And you're going to find that not many doctors know about this and not many recommendations know about it. And, it's a funny story. The way I learned about it was one of my study participants told me, as we're doing a keto diet study, that one of the first visits back, she told me her heartburn was gone. And I said, well, tell me more about it. And we weren't doing a study on heartburn. We were doing a study on weight loss. But she comes back and I said, well, I remember to this day, this is many years ago, who it was. And I said, no, go and test. I don't think I hadn't heard of that before. So she went out and she tested the typical spaghetti and meatballs and had heartburn. And every time she said, well, this is what I had, I'd say, go back, try it again with this, without that. And it turns out that it wasn't the meatball and the sauce, it was the spaghetti. So it wasn't the spiciness of the sauce, it was the bread. So every time she had a combination of the starch and the sugar with the thing we always thought was the problem, people are advised not to have spicy foods if they have heartburn. That wasn't the cause at all. It was the adding the starch to the spicy food that gave it. So as she kept coming back, and I started paying more attention, and another person said, oh no, I don't have heartburn either. And so we wrote a case series in the literature about these different people who didn't have heartburn anymore after they started the diet change. And then of course, this was back when I actually was learning from Dr. Atkins and Jackie Everstein. They had a clinic, and I went back and said, do you see this? And he said, of course, all the time. And Dr. Atkins said, and I put it in my books, and sure enough, it's in the Atkins books and in there in a big way, that one of the most reliable things that a low carb or keto diet does is gets rid of heartburn. So, as a kind of a young researcher trying to figure out how things work and why and all that, we did a study on heartburn. And the reason I can confidently say that the keto diet lowers the stomach acid is that we have a paper published now. I pulled it up. It's published in 2006, where we put these pH probes. You may not know that these exist. You can actually put a little tube down someone's nose and throat into the stomach, and it measures the acidity, all day long. It's a advanced testing that a gastroenterologist will do if they're trying to figure out a complicated case of heartburn and acidity. So we did a study where we put these pH probes in people who had refractory or difficult to treat heartburn. They had excess acid. We put them on a keto diet, and within the 6 days of the next measurement of the pH improved or became less acidic. So the acidity in the stomach went down after 6 days, which correlated as well with the symptom improvement. So the keto diet, in the way we tell people to do it, lowers the stomach acidity and fixes heartburn symptoms by reducing the stomach acid.
That is absolutely incredible. To be honest with you, I've never heard about that story, and I actually didn't know that you'd done a study on that. So I find that absolutely fascinating and incredible at the same time. Now, most people think of GERD and heartburn as kind of benign conditions, but I also have learned that it's possible that if it goes untreated, can lead to a precancerous condition known as Barrett's esophagus. And I don't even know if I'm pronouncing that correctly. Is this correct, or is this very, very rare? Is this something that people have to worry about?
I think it is a concern. It's not common, but Barrett's esophagus is thought to be from this irritation from stomach acid at the bottom of the esophagus, where the esophagus meets the stomach, the food pipe and the stomach. And so the only way to know if you have that is if a doctor looks down and takes a sample or biopsy of it, and then people are given antacids as a routine, because most GI doctors, gastroenterology, and most stomach doctors don't know that a keto diet fixes the acidity and the symptoms. Yeah, it's every now and then, if you have to pop a Tums, once a month or every 6 months over the holidays, I don't think it's a big deal. But if you have recurring heartburn, day after day or every week, this is something that you want to take action on. And it's not just growing older that makes you have heartburn, even though that might be something you saw in your parents, for example. It's definitely diet related. And through the years, the paper we wrote was 2006. I've only seen one other study address this as a low carb diet and heartburn. And it may be that you can have higher carbs and have the heartburn go away still. And I recall this study went up to, they defined a low carb diet as up to like 50 through 100 grams of carbs, but they took away the starches. And so it may be more related to that bread and pasta, the refined flour, than actually the grams of carbohydrates. So you have to understand that our method takes away gluten, it takes away the simple sugars, it lowers the total carbs, so it takes away things like potatoes and pasta and rice. And so what's interesting is I really want to see more research here, or have people tell me their own experience, because it may be that you don't have to do a 20-gram sort of diet to get that sort of heartburn relief. It may be that you could be at those different phases we talk about in our recent book, End Your Carb Confusion. You may have resolution of the heartburn even though you're at a higher phase. But the study we did used the first phase, or a 20-gram total per day or keto level, and heartburn went away 100%. So it'll be interesting to see, as people cut out the refined sugars and starches, you may have resolution of the heartburn even at higher carb levels.
Now, I've heard you mention many, many times and through different videos that we've done together that the success rate for curing GERD or acid reflux is 100% for those that stick and follow the program.
Pretty much. So, but that excludes if someone has one of those anatomic abnormalities, the hiatal hernia being the most common thing. Generally, you're told you have it, so you might not know that name, but if you've been told you have it, you'll know that name. Hiatal hernia just means an outpouching of the stomach. So it's not a hernia like in the groin area. That's the most common one, or in the middle of the stomach, out externally. So hiatal hernia is a stomach and esophagus issue. But even then, the heartburn symptoms may go down even if you have that, because the acidity goes down with the low carb keto diet.
Now, I know you mentioned 6 days. Your study was over 6 days. How long does it typically take for someone that's suffering from GERD or heartburn? How long does it typically take when they start going on your program?
Yeah, it's just a few days. Now, if someone comes to me, they're on a boatload of medicines. Let's say they're on 6 or 10 medicines. I don't always cut them out all at the first visit. Someone comes to me, they're just meeting me, and the other doctors they've trusted for years have them on all these medicines. So the art of doing this is I don't say, okay, stop all these and you'll. So I let people who are on medicine sort of figure it out for themselves, because if you're on one of these medicines for weeks, say, it's not a big deal health-wise. The very little toxicity to them. So I'll have have you had any heartburn? So say someone comes back at a month, and they'll go, no, I haven't. That I didn't notice. And are you still taking that medicine? Well, yes, I take. So they're not having heartburn on the medicine. I'll say, well, why don't you wake up, one day and see if you get heartburn, and if you do, then go back on the medicine. But this is called a trial off the medicine. So, do a trial off the medicine. If the heartburn doesn't come back, there you go. And what's fascinating is it can happen very fast. And again, that study we did showed that in as little as 6 days, there was symptomatic improvement. And, when I look back, we didn't have oodles and oodles of people. I think we had, I don't even have it in the abstract. We had 5 or 6 people in the study. So, but this is a clinical signal of hundreds and thousands of people who come in telling me they're no longer needing their medication or for heartburn, or they no longer have the heartburn. It's pretty amazing.
Excellent, Eric. Well, thank you so much again for everything. That's all for today. Don't forget to get Dr. Westman's free top 10 fat loss tips. The link will be in the description. From time to time, you hear us talk about the Adapt Your Life Academy. When we talk about things like GERD and hypertension and diabetes and other metabolic related illnesses, we run a course called the Keto Made Simple Masterclass. We run this course every 6 weeks or so, and that is to help people to implement this program, Dr. Westman's method, the ADAPT method. If you'd like to learn more and about other online courses coming up, which we will be launching from time to time, you can go visit our website at adaptyourlifeacademy.com. And if you'd like to see future videos or past videos, you can find us on YouTube, Instagram, Facebook, and Twitter under the name of Adapt Your Life. And on behalf of Eric and myself, this is us signing off of another episode of Conversations with Dr. Westman. Eric, thank you so much for your time. We look forward to seeing you again next week.
Thank you, Glenn.
Thank you.
If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.